greatest fears I have had over my career is the concern of developing Alzheimer's dementia. I really don't have any history of dementia in my family. However, simply dealing with my patients and family members who have developed Alzheimer's dementia has made me realize the devastation this can cause for everyone involved. You are basically just trapped in your body. When you lose your ability to think or reason, you have certainly lost your life here on this earth. You no longer can function in life. You can't relate to the world around you, and you become a burden on your family. Therefore, anytime I see a study that shows me how I or my patients can reduce the risk of developing Alzheimer's dementia, I'm immediately very interested. Well, this past month, I came across a very interesting study that was presented at the annual meeting of the Radiologic Society of North America in December of 2012. This study demonstrated that elderly individuals who were the most active reduced their risk of developing Alzheimer's dementia by 50%. These researchers looked at brain volume in 876 elderly individuals with and without Alzheimer's dementia and basically measured brain volume. It is important to note that one of the characteristics found in the aging brain is the loss in this brain volume. They noted there was a significant decrease in the loss of brain volume in those individuals who were active compared to those who were not active. The key was aerobic activity. Those individuals who had the most aerobic activity had the greatest gains. They noted a significant increase in size of the areas of the brain that are critical for memory and learning. Those individuals who were inactive demonstrated a significant loss of brain volume and therefore brain function in these critical areas. Therefore, those areas of the brain that are benefiting the most from active lifestyles are the areas of the brain most affected by Alzheimer's dementia and our ability to think and reason. Now, Dr. Candace Johnstone of the Medical College of Wisconsin stated that this study shows that physical activity actually changes brain volume and that this benefit can be obtained through a variety of activities. You see, it didn't seem to matter what you did, but rather that you were active. Whether you were walking briskly, gardening, swimming, biking, hiking, playing tennis, or just dancing, it did not matter. What was important was the fact that you were active. The only thing the body does not handle well is inactivity. The activity level was only about 30 minutes of some kind of aerobic activity about 5 days per week. This is the level I have always been recommending to my patients. However, when you see studies like this one, it emphasizes the importance of being physically active our entire life. There are not many findings in medicine where a simple lifestyle change can reduce a serious illness like Alzheimer's dementia by an amazing 50%. Therefore, I am going to continue to recommend that my patients eat a healthy diet, consume high-quality nutritional supplements, and yes, have a consistent, modest exercise program.